If this week has shown us anything, it's that the pandemic is far from over. Welcome to the 10 o'clock news. I'm Jesse Pagan.
I'm Carlo Cicchetto. Marcella Lee has the night off. We have a lot of ground to cover tonight, including concerning new details about the highly transmissible Delta variant. Top health officials say the new strain is as contagious as chickenpox.
Now, as the Delta variant spreads, some businesses are requiring customers to show proof of vaccination. Just tonight, a Hillcrest bar became one of the first in San Diego to enact that policy. But before we get to that, let's take a look at the numbers. Today, San Diego County reported the highest number of daily COVID-19 cases since early February, with 1,273 new confirmed cases.
Yeah, hospitalizations due to COVID have increased more than 300%, and ICU admissions jumped 120% over the last month. In the same period, the local COVID case rate jumped from 2.1 per 100,000 people to 19.3. County public health officials are now recommending that everyone wear masks indoors regardless of vaccination status. The war has changed when it comes to fighting COVID-19.
And that's the warning coming from a new CDC report focused on the rapid spread of the Delta variant. Amanda Shotsky is in Kearny Mesa with how experts say we should move forward.
The CDC now says the Delta variant appears to be as contagious as the chickenpox.
The enemy is changing its tactics. You have got to change your tactics.
The enemy, the new Delta variant of COVID-19. A report released today by the CDC shows an alarming rise in cases, now accounting for 83% of all infections. But even more troubling is the new data showing that the vaccine doesn't appear to be stopping the spread.
If you get infected and you were vaccinated, you're just as likely to spread it to somebody else as if you were unvaccinated.
It's information like this that has some who are already on the fence about getting the shot even more hesitant.
If you go to all the trouble and you make that decision to protect other people and you get vaccinated only to find out that, oh my gosh, I can still get COVID and I can still transmit it, that's why we still have questions.
Amy Reichert is one of the leaders of Reopen San Diego. While she says she's not an anti-vaxxer, she still doesn't feel comfortable getting a shot that's not FDA approved.
Right now, the 3 vaccines in the U.S. only have emergency use authorizations.
I believe if you want to take the vaccine, you absolutely should. That's your choice. My position, me personally, is I want to wait.
In an interview this week, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, says that FDA approval could come as soon as August. But medical professionals like Dr. Jonathan LaPook says there are still many benefits to getting the vaccine.
There are only a relatively small amount of breakthrough infections out of the more than 160 million people who have been vaccinated in the United States. And then a 25 times reduction in the risk of hospitalization, 25 times reduction in the risk of death. That's very effective.
Meantime, the CDC is urging local health authorities to consider ramping up prevention strategies like universal masking for public indoor settings, even for those who've been vaccinated.
Local health officials are still encouraging anyone who's eligible to get the vaccine and, of course, to bring a mask.